next client. Oh, okay. Haven't seen them for quite some time. Well, it's been absolutely ages. So hopefully it'll be good seeing them again. Waving us the time. Okay, so they should be here any minute now. Hi. I was literally just looking at the records I have and who I was meant to see today, and I just saw your name, and I was just thinking it's been such a long time since we've seen each other. So first of all, I just want to say, how are you doing? I know it's a bit weird sometimes for doctors to ask how you're doing and whatnot, being, not as, informal as we are, but yeah, it's always really great seeing you. Yeah, it really is, yeah. Yeah, you're one of my favourite patients, so yeah, you always brighten up my day. Yeah. So yeah, how you been? Yeah, no, I've been on a long vacation myself. Yeah, had a lot of time off. Spent up over the years of working constantly. So yeah, treated myself, had some time off, rejuvenate, recuperate and whatnot. Yeah. So no, I've been really good as well. Thanks. Yeah. But anyways, what actually brings you to the doctors today? Hopefully nothing too serious. Oh, okay. So you're just here just for a general checkup. Yeah. No. Yeah. Of course. It being winter, flu season and whatnot, you want to make sure your body's fit, in shape, healthy, everything's working fine. Yeah, of course, yeah, no, it makes perfect sense, yeah. So, should hopefully be fairly easy for the both of us today. Shouldn't require too much from you today. All that I ask you really to do is sit down, relax, make yourself comfortable, and yeah, we'll just get things going from here, yeah? Okay, so it has been a while, so we are just going to have to update your records and data just a little bit just to make sure everything's up to date. Is that alright? Okay, brilliant. So, I assume your name is the same? Cool. Yeah, we just have to re-enter stuff just because, yeah, we need to keep things, up to date annually and whatnot. So yeah, nothing too incriminating will be asked of you right now. And your last name is spelled, yeah, with the, yeah, I always get it mixed up. And cool. And your age? Haven't aged a bit. Yes, I do tell all my clients that. Okay, and where are you from? Where's your house of residence right now? Okay. And that's number, okay, cool. Okay, and have you had any checkups in the last year or so, in the last couple of months? Okay, and is there anything of notice that I should put down on these records? It doesn't say there's anything in your records right now, but I would just like to hear from you just in case I've missed anything. Okay, so, okay, cool. So yeah, today should be pretty easy, yeah. Okay, cool. So that should be everything for now, all the information that we need, and we will update your record just in case we find anything today during your checkup. Okay, brilliant. Okay, so we're not going to do anything too in-depth or serious today. We're just going to go over the general basics. So yeah, we're not going to be too demanding of you physically. This should be a pretty simple process. So yeah, all you've got to do is relax yourself. There's no need to be worried. You're in safe hands. You're in a safe pace, and all you need to do is just be calm. Yeah, it's all going to be okay for you. So yeah, okay. So first of all, I just want to monitor your heart rate, and your breathing. Okay, so I'm just going to put my hand on your chest. We don't have all the equipment here. We are kind of a B-Tech pharmaceutical, so bear with. And I just want you to breathe normally for me, okay? So just be calm, just breathe normally. I'm just gonna feel your heart rate. I'm just gonna monitor your breathing, how it feels. So yeah, just breathing like that. You don't have to slow down your breathing, just normal rate. Okay, that's good. Okay, good. Okay, so now what I'm going to ask you to do is actually hold your breath, and I would like to hold your breath for as long as you can, for a decent amount, at least for 10 seconds would be preferable, but if not, then that's absolutely fine. Do not force yourself to go as far, too far, to say the least. Don't make yourself pass out, is basically what I'm trying to say, okay? Yeah, we've had a couple of patients in the past that have done that for reasons we don't know, but they have. So I know you're not as dumb as they are, so I probably don't need to tell you, but yeah, so just gonna put my hand back on your chest, and if you could just now hold your breath. Keep on holding if you can. Okay, good. And feel free to release anytime you want. Okay, brilliant. That all seemed good to me. We're going to check one more time just in case I missed anything. So again, I'm going to put my hand on your chest. Just stay calm. It's all going to be alright. And if you could hold your breath. That's good. Just keep on holding it. Okay. And release. Okay, so your breathing, your heart rate seems all normal to me, so no need to worry, nothing we need to really note down or jot down. For your age, you are perfectly healthy. So yeah, well, for your heart rate and your breathing at least. Okay, so now, let me just get my gloves on, because now we're going to move to your face, where most of this examination is going to take place. Okay, so I'm going to start with your mouth. I'm just going to look at the back of your throat, because like I said, it is flu season, so there's going to be a lot of flus, there's going to be a lot of coughs going around, so we just want to make sure there's no readiness or swelling or potentially any pus in your throat. You say your throat isn't sore at all, is it? Okay, that's good. So theoretically, we shouldn't notice any problems, but it's always good just to make sure. Yeah. Okay, so apologies about that. Finally got them on. So now we can start getting a look at the back of your throat and just your tonsils and anywhere in the mouth that may need some care. Okay. So I have my trusty pen light. This will be shone in your eyes later on, so just be wary of that. Okay, so if I could just ask you just to open up your mouth, and if I could ask you to lower your tongue as much as you can, and that will be perfect. And I'm just going to get a little bit closer here, and I'm just going to have myself just a look around. Yeah. If I need to, I may need to put my fingers inside of your mouth just to hold things down. So please don't bite off my fingers. Essentially, again, I've had someone almost do that. I know I've had some weird patients, but okay. Yeah, you could just press down your tongue just a little bit, so I can see a little bit of the back. Okay, it's all looking good. I can't really see any readiness or any soreness, and definitely no build up of pus or anything. Okay, again, I'm just going to stick my finger in just a little bit more, just to hold down more of your tongue. Is that okay? Okay, I just need to get a good look at either of your tonsils. Okay, yeah, that looks good. And then looking at the other side. Yeah, okay. Yeah, that looks good. Okay, that looks all good to me. Okay. Well, safe to say there is no readiness, no build up, no rashes that we need to be concerned with today. Like you said, you didn't have a sore throat, so typically we can tell if there's going to be any readiness. If you do have a sore throat, you can typically feel it. So But yeah, it's always good just to have a look, just in case. But you are all good there, so that's okay. Actually, I do just quickly want to have a look at your tongue and your teeth as well. I'm not a dentist, but I can forward you onto a dentist if I think there's any issues, or any dentistry issues that you need to have a look at. Okay, so if you could just open up your mouth one more time for me. And if this time you could have your mouth open, but your tongue also sticking out slightly for me. Yeah, brilliant. I just want to get a good look at your tongue. Okay, off the bat I can see there's some whiteness on your tongue, and typically this means the tongue is not being brushed enough, which I know is difficult for some people with strong gag reflexes. It can be quite hard to brush around the tongue, but just my advice, you don't need to go to the dentist for this, just try to start brushing your tongue just a little bit. Don't worry, it's nothing to worry about, your tongue's not going to fall off anything, just yeah. As for your teeth, really I'm just trying to see for any cavities or anything that looks a little bit troubling or painful. And now you haven't mentioned anything. Okay, actually if you could just look up for me quickly. Okay, that's perfect. You haven't mentioned any pain in your mouth, no toothaches, nothing like that, no? Okay, and yep, just get around the end there. Okay, well, your teeth are looking good to me, so we don't need to forward you onto a dentist or anything, but if you haven't had a checkup in a while, it might be advisory just to go to the dentist, yeah, because a lot of people do disregard the dentist, they kind of ignore it, and I see why. It can be scary, no one likes, having to confront their fears. So yeah, I wouldn't say it's immediate, but maybe in a couple months' time, you might want to book an appointment just to get some more professional advice. Yeah, okay, but that is all good for now. Now I want to move on to your eyes. Okay, yeah, you've got beautiful eyes, by the way. Yeah, I do say that to all my patients, but yeah, anyways, if I could just shine the light in your eyes, this may be quite bright, so try and keep them all open as much as you can. Okay, brilliant. Okay, so the light is coming in. Okay, and I'm just going to be looking at both of them. Right now I'm just having a look at your left eye. Okay, and just keep it open. Okay, and then move it over to your right eye. Okay, looking good. Okay, and now if you could just look up for me. Okay, yeah, just keep it holding there. If you need to blink, don't worry. Well, I'm not a wee bit angel. Feel free to blink. Okay, and then move it over to your other eye. Okay, looking good. Okay, and now I can ask you just to look down for me. Okay, looking good. Just seeing how your eyes react to the light. Okay, and yep, still looking that down for me. Okay, good. Looking good. Okay. Well, off a observation basis, your eyes are looking pretty healthy. I can see you're not wearing any glasses, so that must mean your eyesight is pretty strong. Okay, that's good to know. Good. So now I'm going to ask you to follow the pen light, and just follow it with your eyes. I'm just going to see how your eyes react to the light moving, and your pupils dilating, if they react properly. Okay. So, Again, this isn't too much of a physically demanding task. You don't have to move your body. You can stay seated. You can stay sitting comfortably. All I ask you to do is just move your eyes side to side. Okay, brilliant. Okay, so we're going to start off with some very basic movements. We're just going to be going side to side for now. Nothing too challenging, nothing too difficult for you. Okay, very good. Very, very good. Okay, and keep following the light. Okay, brilliant. I'm just going to be looking at your eyes, okay? You don't have to look at mine if you don't want to. If it's making you uncomfortable, you can look at my nose, you can look at my mouth. All I ask is that you just look straight forward. Okay, good. Okay, and now we're just going to be moving the pen light up and down, okay? Very slowly, okay? So, it's coming up. Okay, good. And back down, okay? Good. Okay, brilliant stuff, really good. And it's coming back up. Good. Just keep on looking forward. I know the light can be sort of abrasive at points, but you're doing good to keep your eyes open. And coming back down. Okay. Good. Okay, fantastic. Your eyes responded perfectly, so there's nothing we have to monitor there or write up about. Your eyes are perfectly normal, perfectly working. Okay, so now we're just going to get the movement to be a little bit more complicated, so not as just omnidirectional, where we're going to get some swivel action in there. Very technical term, I know. So again, just keep your eyes following the pen light. Sorry, not I asked you to follow the pen light, not to keep your eyes looking at me. Forget what I said earlier. You can tell it's been a while since I've been doing my job, can't you? We all make mistakes, so do not look straight forward. Keep on looking at the pen light. Apologies for giving you mixed messaging earlier. Okay, sorry about that. So yeah, keep your eyes on the light. Okay. Okay. So now I'm just going to get a bit more creative with the movement. Okay. Got some more swivels in there. Okay. Good. Just keep on following the light for me. Okay. Good. Okay, and I'm just going to mix up just a little bit more as well. Okay, and coming back down. Just following the pen light. Good. Okay, and now we're just going to do some circular motions, just some big circular motions, okay? Good. You do really good. Okay, get some nice eye roll movement, just so we can have a good look, observation and estimation. Okay, good. Okay, and now mixing up the patterns a little bit. Just some sporadic motion, okay? It's going to be random movement, just keep focused on the pen light for me. Okay, brilliant. So that was all good there, no need to write up anything. Your eye movement and reactions are perfectly normal. Okay, so now we are just going to do just one more eye test. Again, nothing too hard, it should be pretty easy and pretty basic. So what we're going to do is we're going to cover an eye at a time, and I'm going to be holding up fingers. And all I need you to do is repeat back to me how many fingers I am holding up. So it will be on a count from 0 to 5 fingers, okay? Okay, brilliant. So I'm just going to cover up one of your eyes, okay? And how many fingers am I holding up? Okay, 2, brilliant. Okay, and the next set of numbers? Okay, good, 0. Okay, and the next set? 1. Okay, brilliant. Okay, and now we're just going to cover up your other eye, and how many fingers am I holding up? 4, brilliant. Okay, and now the next set? 5. Okay, brilliant. And finally, the next set of numbers. Okay, 2. Brilliant, brilliant. Okay, so again, you can see perfectly. Again, it's a very, very basic task I'm asking of here, yeah. So it's just basically testing to see if your eyes are working properly, any like blurriness, any vision loss, but your eyes seem to be working fine, perfect. You're not wearing any glasses, and you've been to the opticians recently. Yeah, so no need to worry there. Okay, so now we're going to move on to the last part of our assessment, and we will be testing your ears. Okay, so first of all, before we actually test any sound-based tests, I want to actually have a look inside of your ears to see if there's any, again, readiness, if there's any sign of infection or anything we need to be worried about. Okay? Okay. Don't worry, you don't have to move. I'm just going to be moving side to side so you can stay comfortably. You don't have to move a muscle, okay? Brilliant. Okay. Okay, so I'm just coming around to the side and I'm just going to have a look using my bed light. Okay. Okay. And I am going to be poking around a little bit, so yeah, do tell me if anything hurts, and I will stop my poking around. Okay. 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 It looks good so far. It looks good. Can't really see any issues or any signs of infection. Okay, there is minor earwax build-up, but nothing of any concern. It's okay, we all get a little bit of earwax build-up, and it is hard nowadays to know the correct method to remove the earwax, so I don't believe you. Okay. Okay. I'm just gonna have a little bit more of a look, but everything seems to be in order. Okay. Okay. Well, that ear was looking perfectly good. Now on to your other ear. Okay. So far, it's looking pretty much the same. Okay. Yeah. Just keep on holding still for me. I'm just gonna move your ear about ever so slightly, okay? Okay, you're doing really, really good for me. Okay. Okay, good. Again, same with this ear, just a tad bit of earwax build-up, but that's okay. It's natural. You can move it pretty easily with the correct tools, just not Q-tips, okay? Okay. Looking good. Just some final checks here and there. Okay. Good. Okay. Well, everything was looking good. No visual problems identified. So now we're just going to test your hearing. Okay. So I have an assortment of items or triggers, if you're familiar with this ASMR thing, which a lot of people, a lot of my patients have compared this to. And we're just going to be creating some sounds in your ears, and I just need you to tell me what you think the sound is. What does it sound like to you? You just have to give me a rough description. So does it sound rough and grainy? Does it sound crinkly and, you know, stuff like that? So basically just describe the sound back to me, and if you can, sort of like a game, just sort of try and guess what the item is. Yeah, okay, so yeah, so not to cheat, keep on looking at me. Don't look down or to the side, okay? I'm going to try my best to hide the items. Okay, so starting out with the first item. Okay, any ideas so far? Okay, you want me to go a little bit longer? Okay. And just to be sure, we will be doing both ears, okay? Okay. Okay, so we're done with that ear, and now we're just going to move over to your other ear with the same item, okay? Okay, okay. Okay, so if you could just describe back to me what you heard. Okay, good. And do you have any ideas what the item could be? I might have shown you quickly in your peripheral vision what it could be, but any ideas? Well, it was in fact a sponge, and it was the rough side of the sponge. Yeah, sponges, they make good sounds. Okay, so we're now going to move on to the next item, okay? And this one I'm going to do a little bit further away from your ears, just because it is a tad bit louder, okay? So I don't want to hurt your ears, you know, your eardrums, okay? So, starting off with the same side, okay? Okay, so we're done with that side, on to the next. And any ideas so far? Okay, you just need maybe a little bit more of a listen. Okay, no worries. Okay, and any ideas? Actually, before we guess that, can you repeat back to me the description of these sounds that you heard? Yeah, so crinkling. Yeah, okay. And any ideas what the item can be? I know this one could quite literally be anything. But yeah, try your best. But, well, it in fact was a packet of biscuits. The caramelized biscuits, like the Biscoff ones or something like that. I don't know. They're not good for you. Look at all that red on there. So, yeah, these will be a little treat for me on my lunch break. Okay, and those are all the items that we actually have, and your hearing seems to be working absolutely fine, absolutely perfectly. You were able to easily describe back the item sound to me, and even make some estimations what the items could actually be. So yeah, I'm just going to write up quickly, type up everything that we found out today into your record, so that we have it for next time, okay? This shouldn't take too long, okay? Sorry, just one moment. Just got to make sure we have everything down. Just because we did have an issue with our records earlier this year. Again, hence I was asking you at the start some more details. Okay, and that should be everything updated on your record. Okay, and let's just send that and save that. Okay, send that to dentist. Okay, brilliant. Well, that is everything that we were checking up today. You are perfectly fit, perfectly healthy, and it's been good seeing you. Yeah, it's been really good. I know it's been a long time. It's been months since we last seen each other. Yeah, so it was good to have a sort of catch up with you. Yeah, no, you are. I know it's, I've been saying, some things I say to all my patients, but I truly mean this when I say this. You are easily my favourite patient. Yeah, you're amazing. You're amazing patient. So yeah, thank you for making my day just that little bit better. Hopefully I can do the same for you. Putting your mind at rest. There's nothing wrong with you. Yeah. Well, no, again, yeah, it's been an absolute pleasure seeing you today. Yeah, so you're free to go. Yeah, there's no more tests to be done. All your records have been saved. And yeah, you can go for a nice walk, maybe enjoy the weather, although it's quite cold right now. So I don't blame you if you want to go home and just relax and chill indoors. Yeah, you're probably going to do that. Yeah, I'm probably going to do that when I get off work as well. Yeah. All right. Well, again, it's been a pleasure seeing you. Yeah. All right. Well, hopefully I'll see you soon for a good reason, that is. But yeah. So yeah, I'll see you soon. All right. See ya.